Excessive alcohol consumption is a risk factor for dementia for several different reasons. Alcohol-related brain damage can involve brain cell death, brain blood vessel damage, essential B-complex vitamin depletion like thiamine and folate, and even head injury from falls and brain trauma. However, moderate, mindful drinking can help mitigate this risk. Limiting alcohol intake to moderate levels, up to 1 drink per day for women and up to 2 drinks per day for men, is recommended. Red wine, in particular, contains resveratrol, an antioxidant that may offer some neuroprotective benefits when consumed in moderation. Herbal teas, such as those made with milk thistle or dandelion, can support liver health, which is important for metabolizing alcohol. Staying hydrated and making conscious choices about alcohol can help protect brain health over time. And if you have a problem with alcohol use, get help. There are time-tested strategies that can help you cut back from to medications that cut cravings to free support, and referral resources like SAMHSA's hotline can help. For instance, SAMHSA's National Helpline is a free, confidential, 24/7, 365-day-a-year treatment referral and information service in English and Spanish for individuals and families facing mental and/or substance use disorders. The free helpline is at 1-800-662-HELP, 4357. Protect your brain from alcohol-related damage and save yourself from developing dementia later in life. Check out some of the links below this video for more tips. And subscribe to this channel to get notifications when new videos on related topics are posted. 1-800-662-HELP, 4357.